Hi, today we're going to talk about instructions before your robotic myomectomy. And I'd like to talk about a few ways that robotic myomectomy helps enhance your recovery. The medical definitions we need to understand before a myomectomy are that a myomectomy is removal of fibroid tumors without removing the uterus. We really usually reserve this procedure for people who want to keep their uterus so that they can have future fertility options. Fibroids are tumors within the muscle layer of the uterus that can cause pain, bleeding, and sometimes infertility. Some people are a candidate for robotic myomectomy, and some people are not. I'm so thankful to have had many years of special training and opportunities that have allowed me to become an expert in minimally invasive or robotic surgery to help with uterine fibroids. Scheduling your surgery is fairly straightforward. You will see on this slide the phone numbers and steps to go through such that we can find a time that works for your schedule, for the hospital schedule, and for my available surgery dates as well. A financial worksheet is provided for you. Our surgery scheduler will try her best to ensure that all of these entities are within your insurance in-network group. The entities that will require payment are, of course, the primary surgeon, which will be me, and the assistant surgeon, which will be one of my partners in most cases, the anesthesiologist, which is the person who will put you to sleep for surgery, the hospital itself, and the pathologist. Of course, we will send all the fibroids we remove from your uterus to pathology to make sure there are no cancerous or precancerous cells. All of these amounts will apply first to your deductible, then to your coinsurance percentage, and then to your maximum out-of-pocket. Our surgery scheduler can help you work through these financial logistics. FMLA and short-term disability come into play when you as the patient will be missing work for your surgical recovery. Our surgery scheduler can work with you to get these forms filled out appropriately. An MRI will likely be necessary for the purpose of fibroid mapping. You see, ultrasound is a very good entity for helping us see how many fibroids and where those fibroids are, but it is not as perfect or as detailed as an MRI. An MRI allows us to see exactly where the fibroid is and if the fibroid is impinging into the cavity of the uterus, which can further affect fertility and bleeding. If we order the MRI, I work with a very special radiologist who has expert experience in reading these MRIs and communicating the information to me in a way that makes your surgery more effective and safer. At your preoperative appointment, we will make sure to discuss all of the questions and concerns you have and review your medical and surgical history. We might ask you to stop taking medications that can thin your blood, and we really want to be sure we review your previous surgeries, especially those that have occurred in the abdomen. It will be important for us to discuss the risk and clarify the details of the surgery. Please bring a list of questions to ask at the time of surgery. We'll also give you orders to go to the hospital and register with them and do any labs, x-rays, or EKGs that might be necessary. There are certain risks to any surgery. These risks can range from minimally annoying to life-threatening or life-altering. Just like driving our car to the office today, we take on certain risks to make improvements in our life. I believe that this surgery is going to be a substantial improvement in your quality of life. But please ask questions or clarify if this list seems confusing to you. The most important reassurance that I can give you is that I and all of the surrounding staff taking care of you are obsessed with your safety, and we are making every effort to do your surgery in the safest possible way. However, especially in the case of myomectomy, we can encounter problems like bleeding. Occasionally, bleeding can even lead to the need for a blood transfusion, and in very rare cases, the need to remove the uterus to protect against bleeding. Other possible complications are injuries to the bladder, bowel, or ureters, or infection that would require antibiotics or potentially another operation. Blood clots in the legs after surgery can happen, especially if we are not active. That's why it's very important, and we ask you to be quite active after surgery, even though we will ask you to not do any heavy lifting or exercise. There's always a possibility that we would need to perform an open incision, although we have previously planned to do the surgery robotically. And if we find any organs that look diseased or worrisome, we might need to remove those during surgery, such as the appendix or an ovary. There's always the possibility of unexpected events with surgery, but we do our best to keep you very safe. Again, the risks specific to myomectomy are bleeding and hysterectomy. It is also crucially important that you understand that you must have a C-section with any future deliveries. When we do a myomectomy, we are putting incisions and weakening the muscle layer of the uterus, and it is very dangerous for both you and your future baby for you to have labor pains or contractions. The day before surgery, in order to prepare, we ask you to eat light, liquids, and soft foods, and to eat or drink nothing after midnight right before surgery. Your surgery will be safer and your recovery will go easier if you've had a bowel movement the day before surgery, so please feel free to take a laxative if necessary. I rarely prescribe a bowel prep before myomectomy, but if I do, the instructions are below. The day before surgery also, the anesthesiologist might call you, so please answer the phone if you see an unknown number. And this is a really important key. Taking Tylenol, just extra strength Tylenol, 2 pills 3 times a day, the day before surgery, significantly decreases your pain and improves your recovery after surgery. So I'd like to ask you to do that as well. The night before surgery and the morning before surgery, please bathe with special attention to your abdomen and belly button with an antibacterial soap. You can use either the one they give you at the hospital or even antibacterial dial soap. Do not put any lotion on your body the day of surgery, and limit alcohol consumption and smoking tobacco prior to surgery for at least a week. What to have at home? Here's your shopping list. You want to have pads or panty liners for post-operative bleeding. Tampons will not be safe right after surgery, but they will be safe about 2 weeks after surgery. You want to have some Tylenol or acetaminophen and Advil or ibuprofen to help with pain control. It's probably a good idea to have a laxative like Miralax, and I think everyone's bowels behave better if you're taking a digestive probiotic. I like the brand Garden of Life. Antibacterial soap, larger size Band-Aids, and antibacterial ointment for the belly button incision would also be helpful. Loose, inexpensive cotton underwear that doesn't put a lot of pressure on your incisions will be most comfortable after surgery. Arriving at the hospital is different for Medical City Plano and Baylor Plano hospitals. Depending on which hospital you plan to have your surgery done in, please review the instructions below. We'll always start with a lot of questions, and it's important that you know you will get to speak to me and the anesthesiologist right before surgery on the day of your procedure to clarify any questions you might have. Family and friends want to be helpful, so it might help to give them some expectations. Your arrival time will be about 2 hours prior to your scheduled surgery start time. But scheduled surgery start times can get delayed depending on what has happened in the surgery room prior to your procedure. So we ask you to be flexible with us the day of surgery. Your companions can stay with you until we take you back to the operating room. I recommend 1 or 2 companions for your maximal comfort. One person will be designated as the point person, and the nurse will ask for that person's cell phone number. The nurse will keep that person updated during the course of the procedure, and then I'll have that cell phone number to call after the procedure if I'm unable to find your family and friends in the waiting room. After the recovery room period, which comes after your surgery, then you will go to a regular hospital room on the women's services floor, the 2nd floor at Medical City Plano, or one of the surgical recovery floors at Baylor Plano. Optimizing your experience just helps you recover better. Wear loose clothes to and from the hospital. Get those loose, big cotton underwear. Bring some earplugs to sleep better or other comfort measures like a phone charger, lip balm, or your toiletries. It's nice to have a friend or family member spend the night with you on the night of surgery, but it is not necessary. Our nurses are excellent. If there's a special food you might crave the day of surgery, that evening perhaps for dinner, it's totally fine to have your family members bring you that special food. Overnight at the hospital is my preference for myomectomy patients. I like to watch you and make sure that there's no excessive bleeding overnight and then check a blood count the next morning. You might have a catheter in your bladder until the morning after surgery, and we will give you the pain medicines you need to control your pain. We'll also encourage you to eat normal food, but not to overeat. We will only continue home medications if they're critical. Otherwise, you can continue all of your home medications when you get home that night on post-operative day 1. The day that you go home, I will come see you either that morning or the night before and let you go. I'll electronically send a narcotic pain prescription and prescription strength ibuprofen to help keep you comfortable at home. It is noteworthy that the majority of my robotic myomectomy patients do not need narcotic pain medicine, but I want you to have a few pills just in case you feel like you need some narcotic pain medicine to help ease the pain if it gets to a higher level. Checkout time from the hospital is 11 a.m. Don't worry if the nurses are running behind or your recovery is running behind, this will still be considered an outpatient procedure. Criteria for safe discharge include urinating well, tolerating pain, and eating small portions of food and drinking liquids. You do not need to have a bowel movement to go home from the hospital. Do's and don'ts. Everyone wants to know. I'm going to ask you to be off work for 2 weeks unless your job requires a lot of heavy lifting and physical activity, and then I might ask you to stay off work for 4 weeks. So, no work for 2 weeks, no heavy lifting or exercise for 4 weeks, and no intercourse or using a tampon for about 2 weeks. Using stairs at home is fine after surgery, and please do take normal showers and let the soap run over your incisions. This is safe. Travel after surgery does run the risk of a higher risk of blood clots in the legs, which can travel to the lungs. We ask you to definitely not travel by air 2 weeks after surgery, and if you already have a trip planned within the first 6 weeks, use knee-high or thigh-high compression hose. Pump your feet at the ankle often and get up and walk around the airplane as often as you can. In case of emergency, it is very important that you go back to the hospital where we did the surgery and let them know that I am your doctor. If you would like to call us in the daytime, please ask for the medical assistant or the surgery scheduler. And in the nighttime, there is always a doctor from Women's Specialist of Plano on call. Below you will see the answering service phone number that reaches us any time of day or night. Diet and bowel function are really essential for your best recovery. Eat what sounds good to you. No restrictions. The only encouragement I would have is that you add a little bit more fiber, fruits that can help you go to the bathroom, like papaya, such as that. Anesthesia and pain medicine can be very constipating, so use whatever you need, including Gas-X or laxatives, to help with gas pain or with constipation. I noticed that patients who take a regular probiotic seem to have better bowel function after surgery. You might have a swollen or bloated abdomen after surgery. This is to be expected and will get better. Physical activity is variable for people depending on the level of conditioning you were used to prior to surgery. I want you to be active. I want you to get up, move around, go to the bathroom, walk to the mailbox, make yourself a sandwich. Those sorts of things. Repetitive or bending motion, like unloading the dishwasher or doing laundry, can be bothersome to the incisions, especially the one in the belly button. So this is a great time to get other family members involved with household chores. I want you to refrain from heavy exercise and heavy weightlifting for about 4 weeks, but walking is always encouraged. Pain management is variable. Like I said, some people don't even need the narcotic pain medicine we give them. It is very helpful to take ibuprofen 800 milligrams a day every 8 hours for the first week after surgery, as though you're on a schedule. And then in between those dosages of ibuprofen, you can take either Tylenol or the narcotic pain medicine to keep your pain at bay. Here is an example schedule that might work for you, demonstrating that ibuprofen is taken every 8 hours and the Norco or hydrocodone alternates with the Tylenol depending on your pain level. Bleeding expectations are variable. You can have on and off light spotting or light bleeding for up to 8 weeks. Your period may be very disrupted and you might notice a shift in the timing of your period. Sometimes the first period after surgery is a little bit heavier, but after that your periods should only get lighter because we've removed the fibroids that were causing heavy bleeding potentially for you. It's a good idea to have some light pads and larger pads at home after surgery, and tampons are allowed at 2 weeks post-operation. The small incisions that will be around your belly button will be covered with skin glue and a stitch underneath. The larger incision that will be around or through your belly button will not be covered with skin glue, as I find that pretty annoying. So I'm going to put some antibacterial ointment over that and a bandage that I want you to not remove until the second day after surgery. Now, once you remove it, take a shower, wash it off. It's totally watertight, but then go ahead and cover it with some sort of antibacterial ointment and a large Band-Aid. This will just help it heal faster and more comfortably. Having surgery is a very big decision, but the benefits can really outweigh the risk, especially if we're looking ahead at family planning or future fertility. I know this is a big decision, and I take your trust in me very seriously. My goal is to help you walk through this journey with the very safest surgery and the most enhanced recovery as possible. Thank you for trusting me with your care.